everyone. Welcome back to my podcast, Love and Courageous. I'm your host, Demetris. And if this is your first time listening to my podcast, welcome. On this episode on Love and Courageous, I will be speaking on mental health awareness and also what is mental health and mental illness, and also the symptoms of it and what we can do to improve our mental health. So, I want to start off by mentioning mental health, what it is. So, mental health includes our emotional, social, and psychological well being. So, this affects how we feel, act, and how we think. Now, mental illness is a physical illness that's a part of the brain that affects a person's mood, their emotions, their behavior, and also the way they think. Now, there are a few factors that play a part in mental health conditions, also known as mental illness. So, life experience, so any type of trauma, if you ever been abused before, also people, that has joined the military, that plays a part in it. Family history of mental health problems, also biological factors such as brain chemistry and genes. Before I get into listing mental illness disorders, I want to list just a few facts here, just a few statistics just to let everybody know. So, 1 in 5 of adults experience mental illness each year, and 1 in 6 of kids between the ages of 6 and 17 years old experience a mental health disorder each year. So 50% of all lifetime mental illnesses begins by the age of 14. 75% of mental illnesses start by the age of 24. And suicide is the second most leading cause of death in people between the ages of 10 and 34 years old. So there is more than 200 different mental illnesses out there, but I'm just going to list a few. One of them is anxiety. Anxiety is a mental disorder where people have severe fear that's related to certain situations or objects, and a lot of people with anxiety tries to avoid exposure to whatever triggers them. Now, there are a few different types of anxiety disorders, and I'm going to list them. So, generalized anxiety disorder, also known as GAD. Now, this involves excessive fear or weariness that disrupts a person's everyday living. Someone that is experiencing generalized anxiety disorder has symptoms such as poor concentration, tense muscles, interrupted sleep, or fatigue. Now, however, people that experience anxiety, they don't necessarily have to be triggered at all to experience anxiety. Panic disorder is another one. So, it's a disorder where people experience regular panic attacks involving overwhelming terror or a sense of imminent disaster or death. Phobias are another type of anxiety disorder. Now, there's a couple of them, so I'm just going to list the different ones. So, sympia phobias, this involves a disproportionate fear of specific scenarios, animals, or objects. So, a phobia is some people, for a prime example, is people are scared of spiders, or you have some people, they are scared of blood or heights. There's so many different types of phobias. But social phobia is another one. So this is also known as social anxiety. So this is where people fear of being watched or judged by others. And a lot of people that experience social phobia, they don't like going to social environments. Agoraphobia is another one. It's where people fear situations where it's hard for them to get away. So basically, a prime example is like an elevator. It's hard for you to get out of an elevator or like a moving train. Now, some people misunderstand this phobia as people being scared of being outside. But now I'm going to step outside of the anxiety disorder. So, another just a mental disorder is obsessive compulsive disorder, also known as OCD. And this is where people experience constant and stressful thoughts and the urge to perform repetitive acts. People that experience obsessive compulsive disorder, also known as OCD, happens to have unnecessary and unreasonable desires that cause them to perform certain behaviors or compulsions. Another mental disorder is post traumatic stress disorder, also known as PTSD. Now, this is a mental illness that is triggered after experiencing a traumatic event. There are a few things that can trigger post traumatic stress disorder. So, a few is natural disaster, physical, verbal, or sexual abuse, or a war. People that have PTSD, some of them experience symptoms such as flashbacks. Schizophrenia is another mental illness disorder. So, schizophrenia is where it impairs a person's perception of reality and the world that is around them. It interferes with their connection to other people. People that experience schizophrenia have symptoms such as hallucinations, and also they might say they hear voices. Also, they have lack of motivation and inappropriate moods. Schizophrenia is a very important mental illness that needs to be treated. If it is left untreated, it can put the person in a very dangerous situation. The last mental illness disorder I will mention is mood disorders. So, people with mood disorders have mood changes. They have a period of high energy and joy, or depression, or mania. So, here are a few different types of mood disorders. So, major depression is one where people mood is very low and they constantly lose interest in activities or events that they used to enjoy. They also experience extreme sadness for a very long time. Another mood disorder is bipolar. So anyone that experiences bipolarness, they experience unusual changes in their energy levels, level of activity, mood, and ability to continue with their daily life. The last one is seasonal affective disorder, also known as SAD. And what happens is that during the fall, winter, and early spring months, due to reduced daylight, it actually triggers the seasonal affective disorder. And what it is that it's basically a major depression disorder. And they say this is very common in countries that is far from the equator. So I'm going to list some early signs that do appear that I feel like a lot of people should pay very close attention to. So here are just a few signs of people that has a mental health disorder. So they distance themselves from friends or family. They either sleeping too much or not sleeping enough, eating too much or not eating enough, having consistently low energy, avoiding activities they usually enjoy, lacking empathy or feeling numbness, experiencing unexplainable body pains, feeling helpless, hopeless, or lost. Also, people tend to drink or smoke or get into other drugs more often, feeling confused, having anxiety, anger, irritability, sadness, constantly arguing or fighting with family or friends, also having extreme mood swings that can cause problems with co-workers, family, or friends, having constant flashbacks or thoughts that they can't get out of their head, hearing voices in their head, having thoughts of hurting themselves or other people, and being unable to perform day-to-day activities or chores, go to work. So these were just the list of signs that people have when they have a mental disorder. But now I'm going to get into the different type of treatments that they have for people that is dealing with a mental disorder. So medication is one of them to help treat people that have a mental health disorder. So a few medications is anti-anxiety, mood stabilizing, antidepressants, and antipsychotic medications. So there are a few that people use, but it depends on your symptoms that you are experiencing and also what works best for you, because every drug is different on everyone. So that's something you will have to discuss with your doctor about. Also, psychotherapy is another one. It's talk therapy. It's where people talk with a mental health provider about their feelings, thoughts, and experiences. And what the mental health provider is supposed to do is help you learn coping techniques and strategies to help manage your symptoms. Now, also, there are treatments at hospitals or treatment facilities. And I know some people don't like going to a hospital, but I'm just going to list it. So they do have programs that allow people to stay overnight for a in-depth treatment, or a daytime program where people participate in shorter periods of treatment. They also have the mental health test, is where you talk to your doctor or therapist about your mental health, and they might take you through a couple of examinations in order to reach a diagnosis. And to get to this, there are a few steps they have to take. So they might have to take blood or do lab tests and physical examination, and also a mental health questionnaire. This helps the doctor understand your thoughts and also your reaction to events or responses, but also help them understand exactly what you're experiencing. Now, they do advise to not take online mental health tests because they are not administered by a healthcare professional. And also, the questions and the answer options are not as specific as they would be if you was to actually go to a doctor or a therapist. Now, there also is a mental health first aid course. It's a national public education class, and it is designed to teach people about the warning signs and risk factors of mental health issues. Now, the people that participates in this learn about treatments and approaches that can help people with mental health disorders. This program is made for people who interact with patients in a healthcare setting, and they also use scenarios or role playing to help the healthcare providers learn how to help a person that is dealing with a mental health disorder. Okay, so now the things that you can do outside of the treatments and the doctor's appointment. So there are just a few things to help people make sure that you keep your mental health in good standards. So, number one, make sure you get good quality sleep. Make sure you have a bed routine. Also, meditation. Meditation is also a good one, such as deep breathing or yoga. And also practicing muscle relaxation. Now, this involves tightening and then slowly relaxing your muscles. And listening to calm music also helps. So, another thing that people can do to help maintain a good mental health is exercising. So make sure you exercise at least 30 to 60 minutes a day. Walking, biking, dancing, swimming, or hiking. Also, make sure that you have a really good supportive system. So, if you can talk to family or friends, do that. And also, make sure that you are eating right. So, make sure you stay away from alcohol and smoking or any other type of drugs. Make sure you eat a lot of fruits and vegetables, whole grains, and healthy forms of fat such as cheese, avocado, nuts, and olive oil. And if you need to take some days off of work, make sure you do that. But also, going and get you a massage is also helpful. But like I said earlier, with the treatments and everything, make sure you go to your health provider, or your mental health therapist. And if you want to, make sure you get involved with support groups. So I'm going to list a few support groups that might be a little helpful. So here are just a few. So one of them is Anxiety and Depression Association of America Peer-to-Peer Support Group, Depression and Bipolar Support Alliance, International Society for the Study of Trauma and Dissociation, the National Alliance on Mental Illness, the Balanced Mind Foundation. Now, just in case anybody don't like going physically to the support groups or actually going inside, for therapy, they do have online talk therapy options. So I'm going to list a few, but some of them are a little high pricey. I just want to mention that. So one of them is therapy through the phone or live video chat. And this costs $65 to $90 a week. It's called Better Health. And you can cancel at any time if you wanted to. But it's great for a large network of licensed therapists. Another one is Talkspace. So this is also therapy through the phone or live video chat. And people that are members of this pay an average copay of $30. But they also offer psychiatry and prescription management. Another one is onlinetherapy.com. This is where they do videos and journaling and also yoga. They say it's great for cognitive behavioral therapy, and they also do therapy through live video chats or messaging and also worksheets. And this costs $40 to $88 a week. And the last one is called Hers. It's for medication for anxiety and depression. It has unlimited check-ins through online messaging, and it costs $49 to $85 a month. So hopefully everyone found this helpful if you did not know. But that was all for the topic of today. And so now I'm going to get into the Black History Month fact. The Black History fact for today will be about Willie James Howard. So in 1943, during Christmas, Willie James Howard, a 15-year-old black boy, sent cards to all of his co-workers at the Van Priest Dime Store in Live Oak of Florida. And he sent one card to Cynthia Goff, a white girl who he worked with, but Cynthia Goff did not like the Christmas card that he gave her. She was very upset about it, so he decided to write her and to, explain to her he don't mean any harm, and that basically saying that he know that she don't think much of his kind of people, but he was saying that, we don't hate you all. We want to be friends. And he was just continuing by saying, he hoped that white people will someday, like black people. And in this second letter, he wrote that he loved her name and he loved her voice. And for a sweetheart, you are my choice. Now, Cynthia Goff, father Phil Goff, did not like that Willie James Howard sent his daughter a card. So Phil Goff and two of his friends went to Willie James Howard home and demanded that Willie James Howard come out. Now his mother was there when the three white men showed up. And Willie James Howard's mother's name is Lula Howard. And she pleaded the white man, but the men dragged Willie James Howard out the home and then drove to his father's job, whose name is James Howard, and kidnapped him. And they drove them to the embankment of the Suwannee River. Then they bound Willie James' hands and feet, stood him at the edge of the water, and told him to jump or be shot. Willie James Howard jumped into the water and drowned, while his father, James Howard, was forced to watch at gunpoint. Willie James Howard's body was pulled from the river the next day. Now, Phil Goff and his two friends that helped commit this crime later admitted to the local sheriff that they took Willie James Howard to the river to punish him, but claimed that Willie James Howard had become hysterical and jumped into the water unprovoked at the thought of being whipped by his father. Now, Willie James Howard's father, whose name is, I'll repeat again, James Howard, was scared for his life and his family. So he decided to sign a statement supporting Phil Goff's account. And 3 days later, James Howard and his family fled Live Oak and then shared the story of Willie James Howard lynching. Also, Willie James Howard's mother, Lula Howard, wrote an affidavit of what happened that day her son, Willie James Howard, was killed, but also in the affidavit she mentioned the aftermath. But that is all for today. And for my next episode, I'm going to speak on mental health in the Black community and the history of it as well. So thank you everyone for tuning in to my podcast, and I hope you all have a lovely day.